Guys, welcome back to Medical Coding with Blue. All right, so I've already posted the answers to Answer Monday. I'm very excited about that because I feel like I'm being very efficient today, okay? I got up very early this morning. I'm very excited about that because I was able to do a lot of stuff before I got into work. Always an exciting thing for me when I feel like I've been successful in the day. Today I feel successful in the day. All right. The question I get asked a lot about in today's topic is going to be about time management. Like, I get questions all the time of like, Blue, you do all of this, teaching, and you do all this coaching, and you do all this research. How do you have time to maintain your production standards? What is it that you do? What are your tricks and tips? Okay, so here's the thing. A lot of what I do now was the result of a lot of trial and error. Like, I had to decide a long time ago, particularly when I first got to this facility, that I had to give myself permission to say there was going to be days that I was not going to meet quota. There was going to be days when I just did not feel like I was going to get anything done, and I had to be okay with it. If I didn't do well on an audit, it was okay. I had to give myself a break. I'm human. Things happen. There it could be a myriad of reasons, but I had to be able to give myself a break because I learned that beating myself up was only going to be counterproductive. The more I beat myself up, the harder it was for me to keep pedaling forward. So that's one big huge part of it is mentally, how are you going to handle the stress of, if you feel like you're falling behind on your productivity, if you feel like you're just like sort of drowning and not meeting production standards, you have to be able to give yourself a break, and you have to be able to say, okay, let's stop and let's look at all of the strengths that we have. For me, I knew my strengths in the beginning, most in particular, was I really knew my medical terminology, and I knew anatomy and physiology. So I was solid there. That was the first part going into this facility. I was like, okay. And I knew the clinic that I was going into because I did inpatient professional services when I first got here. And the rules are a little different. So a lot of people did not want to do this. Even from where I came from, they just did not want to do it. So when I arrived at this facility, they wanted me to do it. And I already knew how to do it because I had been doing it for a while. So I had that confidence behind me. But then it was just like, okay, now we got to have production. They used a different system here than what I was used to from my old facility. So that took a minute to get used to. So it was just like, okay, so my speed suffered a little bit because now I have to learn this new system. This new system was being a little slow in the beginning, for me at least. And it was just like, okay, so it took some getting used to. But again, deploying that time management of like, okay, if I know it's taking me too long to get through this particular set of encounters, then I know I can move on to the next one. And that's something else you got to decide too. So what I like to do now is I like to say, okay, I already know what I'm doing. I understand these clinics. If I start hitting something, if I feel like I'm hitting a wall with like a clinic or something, I know to move on to another clinic. I don't stay stagnant in one clinic too long. I have 5 clinics. Is it 5? Yes. I have 5 clinics that I actively code. I assist in other clinics, which is why I had to think for a second. But I actively code in 5 clinics. So this gives me that flexibility to be able to move on to another clinic if I feel like I'm getting stuck on a clinic. Or if maybe there's a particular provider that's taking a little bit more time than usual, then I can just move on to another one just to sort of give myself a mental break. The whole thing is, I've taken the time with each and every one of my providers to work with them, to get them all on board and to get them all coding in a way that I understand what they're saying and they can convey what they want in this encounter. Sometimes this doesn't always happen, okay? Sometimes we hit a bump and I have to go and talk with them. But that's okay. For the most part, they do very well, and this makes if for a more efficient coding. If I have to have a provider that is taking a little bit more time and is starting to impact my productivity for that day, what I will do is say, okay, I'm going to give this particular provider 1 hour. And if I'm going really slow with that particular provider, then I need to move on to the next one. And I do. I look for the most pressing encounters that I need to hit first. And it could be just a myriad of factors of whatever I'm looking for that day. It could be my boss is asking me to do something or pay special attention to something. Or it could be just a auditing cutoff. I need to hurry up and get this done before it gets pulled for audits. So there's a number of things that I look at when I'm managing my time. But I have to make sure that when I am coding, I'm going with my first instinct. And that's something that you're going to have to learn. That's something that took me time to learn. Because sometimes in the beginning, I would get hung up and I'd stay stuck on this fence of like, should I or shouldn't I? Should I, shouldn't I? Should I, shouldn't I? And after a while, it was just like, it's just too much. It's like the hamster is just running on the wheel. And I got to push the hamster off. So it's just like, okay, let's just go with our first instinct. And most times when you go with your first instinct, it's right on the money. So it's when you start overthinking that all these precious minutes start going by. And this is what I talk about even when you're prepping for your exams. You got to make sure if you've not taken your credential exams yet, make sure that you are using time management. Go with that first instinct and just keep moving. If all else fails, your brain will kick in and remember what it needs to remember at the time that it needs to remember it. At least that's the hope that I always have when I'm doing things like that. So you have to be able to use those skills. And it's a skill that you will pick up after time. After you've been around for a little while in the industry, you will learn to trust your first instinct. But like I said, sometimes you will get hung up on something. And if you get hung up on something, reach out to somebody. And I always look at it like this. I always reach out to somebody that's smarter than me. So I will call my friend that I always ask for coding advice. I will say, hey, I need you to help me with this one. And I'll tell her the scenario. And she'll usually say, oh, it's this and this and this, because she has this incredible photographic memory that she can remember things like where she sees them and stuff. She's amazing. And I will only ask her questions. I very rarely will ask somebody else. But if I ask somebody else, it will be because I don't have access to my friend. And it's just, whoever I think would be the best to answer this. I'm very selective on who I ask questions to, because sometimes and I've seen people do this where I ask them a question and it's sort of like, and you can sort of see oh, I don't know how to answer this, or I don't know which way to go. Or sometimes I'll hear what they say and it's just like, where did you get that? and it just depends on what's happening at that moment. So be very selective on who you're asking questions to. But take the time to hear them out if they are presenting you, especially with evidence of how they got their answer. Always be sure to listen to them. Don't not listen to them because you don't like what they have to say, okay? Especially if they have a resource, always listen to what they say. But again, that is part of doing time management, is just going with your first gut instinct. And then if you get stuck, ask somebody that you trust to for some help, and then move on, And if all else fails, put that encounter on pause. Now, don't put it on pause too long, but if you just have to, if you started in the morning and you need to put that encounter on pause, and then maybe you'll come back in the afternoon and look at it again with the fresh eyes, and after lunch, after you've had a snack, and you can go back and look at it and say, oh yeah, this wasn't so hard after all. Then you can just, move on with your day. But in the meantime, you'll be able to pick up the slack and pick up from where you were slowed down earlier in the day. You're not always going to be able to hit your productivity every single day, okay? The productivity for me and my facility in my clinics, my specialty clinics, is 90 per day. Sometimes this is very hard to hit. It doesn't sound like a lot, but it is sometimes hard to hit. Sometimes I can fly through 90 encounters and hit it very quickly. But there are times when it's just like, holy crow, I cannot get through this quickly because I have a provider that is taking a little bit more time. Because like I said, sometimes they will hear something from somebody else and they will try to put those things into their notes and change how they're documenting. And it's like, whoa there, Nelly. No, we're not, we can't do that, or something, or whatever the case may be. If they change on me, and this is why I'm always sending out coding tip of the week and telling them, please don't change anything unless you've talked to me. If you've asked, if you've clarified any kind of changes you're going to make to your documentation, or how you're documenting rather, this is when having good conversation and good communication with your coder is key. So this is why I tell them that, because I know how each and every one of my providers documents and their habits. It does help me to decide which provider to hit first. And I am one of the ones who touches a good amount of encounters in a day. So being able to know which providers to be able to move through helps me with that. But again, this stuff takes time. You're not going to always get it in the beginning. And if you're starting to feel yourself like, I'm not meeting productivity because, I feel like I'm going too slow, talk to your supervisor. That is another thing that I'm always going to suggest, is have open communication with your supervisor. Now, you're not always going to get stuck on everything, okay? Not every encounter is going to be so long that you're going to have to be, it's so arduous that, you're spending all this time. No. There are going to be ones that you get like that, but not all the time, okay? But if you do get stuck on one like that, talk to your supervisor, take it to them and say, hey, I had this encounter that had like 15 different diagnoses, or I had this one that had like 5 different complicated procedures. This took time. Communicate with them so they don't think that you're just goofing off. Sometimes your supervisor will understand and maybe let you take some of that time off of your production time, so that way it can sort of pause your day and you're not expected to hit all of that huge amount, okay? Being very good with record keeping is so important. Whenever you're doing a class, whenever you're talking to providers, whenever you're doing anything other than coding, you need to write it down, because, not all facilities will do this, but at least you know where your time is going. In my facility, we do have to write down what we're spending other time on. Like if we're not coding, we need to write down what it is that we're doing. Now, don't abuse it. That's what my boss has always said. Do not abuse this, because she will take it away, and we'll be right back to square one. But she knows me better than that. She knows that I will, not that I'm saying anybody else is doing it, okay? Don't get excited, I'm just saying that she knows that I'm very conscientious about the things that I do. They tell her, my my providers will tell her, because she's told me before. She's like, Blue, Dr. So-and-so was talking to me today, and he says that you were really helping him, and he wanted to thank you. And I'm like, yeah. But, she does hear feedback from my providers, which is good, even good or bad, thankfully I haven't, knock on wood, no bad, because, I am pretty well straightforward. And then if anybody knows, they know that I will always strive to take very good care of all my providers and make sure they get credit for everything. But again, using good time management skills, trusting your first instinct, establishing those good relationships so you can head off sort of problems before they become problems. And that way you can make sure that everybody is clear on everything. So always do that. Let's see, what else? sometimes I do have to close the door. Thankfully, I have my own office. I can just close the door. And a lot of times, though, if I close the door for a few hours, I'll be left alone. Sometimes I won't. I'll hear that knocking, like, hello? And so it's just like, hello, come in, whatever. And they're like, I thought you weren't here. Well, sometimes I just have to concentrate. And usually when they see my door closed, they'll know that I'm trying to concentrate on something. And so it's not unless they really do need me that they just come right on in. But yeah, that's something that, they know when it's time for business, it's time for business. And they've seen me on those days where I don't come up for air. I'm literally just in my office, go, 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 because something I need to finish, or I need to make sure that this is going to be covered for this time. And that's always going to be my priority. So when I work on classes, I do take that time out. I usually try to make it no more than an hour and a half if I'm working on it in a day. And I try to do it as quickly as I can because otherwise my supervisor's telling me, "Bleu." I'm like, I know. But if I take the time to explain it, it's a lot easier for the providers. It's a lot easier for me. Everybody's clear on what they need to do. Okay, so good communication is really key in that. But don't beat yourself up. Again, if you can't meet your quota in a day. But that is how I balance everything. If I work on things that are too difficult in the morning, I will make it up in the afternoon by working on easier encounters, easier providers, or providers who have more of stable documentation, as far as like they do a lot of the same thing. Some of them do repetitive things on certain days, but other than that, it's a lot of it is just scanning their documentation and just reading it really quick and ciphering out what I need to and just going from there. And I'm very lucky in that the majority of my providers select their own diagnosis correctly. So a lot of times when I'm doing this auditing, sometimes I will have to go in and change a diagnosis code because I can find one that's more specific. Those are the things that I tend to do with some of my providers. So again, that is how I do my my stuff. But as you spend time in this field and as you keep going, it gets, for me, it's so much fun because I get to like read and stop and look at these things and then read through these encounters that are so fascinating. And then sometimes like having to talk with my providers and getting them to explain something, and then that light bulb going on is just like, oh, that's fun for me too. So it makes it like it's not work, and it's not that it's all like just being, it's not even about being social. It is literally about reading and learning things. That is what I like to do. So, but yeah, that's pretty much it. And being organized and taking lots of notes about what you're doing during the day. So this way you can find your patterns. You can find where there's slow leaks on your time. If you're finding that a coworker is wanting to talk to you too much, you got to do what you have to while still maintaining being professional, but yet letting them know, hey, I got to work. And that's something that sometimes you have to discuss as well. And that's where the good communication comes into play. You have to let them know, hey, I like talking with you. It's fun, but I really do have to concentrate on this. Okay. And sometimes you may get people that are upset with you because of that. But at the end of the day, you're there for the providers. You're there for the patients to make sure that the provider's getting all the credit that they deserve, and the patient's documentation and all the diagnoses that are being selected in the procedure codes are correct based on the documentation. So that's how I always think about it. But yes, I know this is not, it wasn't very many tips, but that is how I maintain my standards, how I maintain time management. So, yeah. So anyway, I'll go ahead and close this up. But if you have any questions for Q&A Tuesday, remember, I am still collecting questions all the way up until I film tomorrow. So I hope you all had a great weekend. I will still be filming during the week. So, but if you're going to take some time away, I hope that you have a happy Thanksgiving and a nice long weekend for some of you who are going to be off in a couple of days. So I will see y'all on the next video. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye!